And just touching on diversity, which is obviously a huge subject, but if we look specifically within healthcare, a lot of the senior leadership roles, there's less diversity as compared to the front line. So what do you think might be, some things that we could potentially do to change that?
I think it goes back to what you do with your high potential talent and with your succession planning. And remember, the wave of immigration and where people end up and how long it takes time. I came to Canada in 1974 and I'm a CEO now because I came at a very young age and was able to go through the schooling system here, which I think may prepare you somewhat better to feel comfortable to get into a role like this. So these things don't happen overnight, but what you have to do is that the succession plan that you're building, you make sure that the team that is in your succession plan is a diverse group of individuals from not only different backgrounds ethnically and from orientation, but also different backgrounds and the kind of talent that they bring to your organization. And it's when you grow from the grassroots up, that's what's going to do it.
And what would you say is the biggest challenge that you are currently facing?
It's health human resources that we are currently facing. And if you want to look at our particular community, it's access to healthcare for our patients in our community because we don't have the healthcare infrastructure in Etobicoke Peel that may be present, say, on University Avenue or in South Peel or in other parts of the GTA. We have a significantly growing population and we can't build healthcare infrastructure fast enough for them and hire enough people to serve them.
So, as you said, health human resources on top of everybody's minds. And I'm curious to hear from you, how much weight does wage itself play in terms of this issue and what may be the real issue?
Yeah, I think for me, I personally think wage does not play as big a part. It may play a part, but I think we just haven't graduated and haven't, provided enough spots for people to train through our education process to be the professionals. Remember, we're not a multi-tier system. We're a one-tier system where everybody has access to healthcare, but they're paid by one payer. That always plays a role in how accessible you're going to make different professions. Because if you're in a multi-tier system where you have private healthcare and you have, socialized healthcare and you have subsidized healthcare, then you can graduate as many docs and nurses as you want because there will always be other people who are going to pay for the services that are available. We don't have that luxury in Ontario, and we're in a place where more than 50% of the budget already goes to healthcare. And I think that has hurt us because each time, let's just say you're adding a nurse or you're adding a doctor to a medical school or a nursing school, roster, that person is eventually going to graduate and add to the cost of healthcare. What we need to think about is the fact that whether you add that person or not, you're probably going to end up paying more to the cost of healthcare at the end. Because if you look at a patient's point of view, a patient that may have an illness and can't access a doctor, and their illness becomes more complicated or progresses, then you're paying more to treat that patient in the healthcare system. If you provide them access and you can diagnose their breast cancer sooner, you can diagnose their coronary artery disease sooner, you can their diabetes sooner, you're probably going to cost the healthcare system less in the end. And I think that's something that we need to get our head around.
Right, because we're always so reactive, right, versus proactive. Right. So how do we change that?
Well, I think the way you change it is that you actually resource things at the point of entry. So you add more medical school spots, you add more nursing spots, and the government has done the nursing spots now, and the pandemic has brought that to the forefront. But those spots that they've added are not going to come to fruition for at least another 3 or 4 years. That's when the people will graduate. You build more healthcare institutions. I can tell you every day I hear about a person who says that, I had a little bit of chest pain. I just didn't want to go and wait in the emerge for 6 hours and then for a specialist. So I decided not to go. And then, God, man, 5 days later, I got this significant chest pain, and I've had this massive heart attack. And I'm going to be off of work for 6 months, and I can't exercise anymore. So that's what I'm getting at, is that providing access and providing service and investing in that is going to benefit us in the long term.